We got our house calls with Dr. Andy, and this week we are starting a series of talks about vaccines because there's so many questions, so many different vaccines out there. So let's get started. First of all, this is a question you get a lot in your practice.
It is. Well, you know, with every new pediatric patient, I have the option of being able to spend about an hour and a half, and about 30 minutes of that conversation is usually spent just on vaccinations.
Why are there so many questions? I know there's a big rumor that they come from like aborted fetuses.
Right.
Is that true?
Actually, there's actually some truth to that rumor. And
really?
It absolutely is. The first time I heard the rumor actually was about a month and a half ago. My first response was, oh, there's got to be a bad joke. But actually, it comes back from the 1960s when the cells of two aborted fetuses, the lung tissue of two aborted fetuses, was used to create cell lines that are still used today in the production of the MMR vaccine, the chickenpox varicella vaccine, the rabies vaccine. Now, these cell lines are very strictly protected by the National Institutes of Health.
Okay.
And there are no fetuses aborted in the United States used for medical research, nor have there been since the 1960s. But was aborted fetal tissue used since from 1960? Yes, those cell lines still exist today.
So in the very beginning, but nothing now.
No.
Now it's all other
Exactly.
means of producing these vaccines.
And it comes up to the age-old, there's an age-old classic medical ethics question about, you know, if a Nazi scientist was killing people and coming up with a cure for cancer, would it be unethical for us to use that cure today? And the decisions amongst medical ethicists, but religious, legal ethicists has all been, yes, it would be wrong for us not to use that scientific breakthrough today in order to save a life, although, of course, we can't condone what was done in the 1960s.
Right. Okay, so that did help us in creating our vaccines, but
Yes.
no longer that's the production method.
Correct.
What about other issues about vaccines? Are they going to make you sick? You know, what do they contain? That sort of thing.
These are all such good questions. The problem with vaccines is that there's so much information out there and so much misinformation out there that as medical professionals, too often we're part of the problem when it comes to our patients. They ask us for information, and most of my colleagues in the office don't have the luxury of being able to explain these things in their complexity.
Right, and taking the time to sit down.
The party line parents get is it's recommended by the CDC, the Academy of Pediatrics, the Academy of Family Physicians. Just do it. And we really owe them more than that. We owe them an explanation because, like any medication, a vaccine has pros and it has some cons.
Are there any cons you can think of right off the top of your head, since you've mentioned that the parents are going to be going, oh no, should I not get my kid vaccinated?
No, I would say definitely don't take from our conversation this morning not to vaccinate, because every child is different. But, for example, some children who might have a history of, autism is out there. We'll talk more about this in the coming weeks.
We certainly will. And right now, if you have any immediate questions for Dr. Andy about vaccines, go ahead and give him a call, 694-6246, or Dr. AOL at phc-md.com. And every Wednesday for the next 4 to 6 weeks, we're going to be talking about vaccines here, all the different types and varieties. So stay tuned for that as well. Dr. Andy, thank you so much.
Always a pleasure.
Stick